Hello everyone, welcome to Pharmacy Lectures. Today we are going to discuss introduction of anxiolytics. So let's start. Anxiety, which can be a normal and often healthy emotion, it is defined as an intense feeling of unease, worry and fear, and there is not a clear-cut distinction between pathological and normal state of anxiety. But the point is, whenever the symptoms interfere with normal productive activities, then it is not a normal anxiety, it is a pathological anxiety, it is said so. And let's see the types of anxiety. It can be generalized anxiety disorder, which can be an ongoing state of excessive anxiety lacking any clear reason or focus, or it can be panic disorder, can be sudden attacks of overwhelming fear that occur in association with marked somatic symptoms such as sweating, tachycardia, chest pains, trembling and choking, or agoraphobia, which is anxiety disorder characterized by symptoms of anxiety in situations where the person perceives their environment to be unsafe with no easy way to escape. And these situations can include open spaces, public transit, shopping centers, or simply being outside their home. Or it can be social anxiety, a fear of being interacting with other people, or it can be specific phobias, strong fears of specific objects or situations, example snakes, open spaces, flying, etc. And now let's see the drugs used for the treatment of anxiety disorders. There can be antidepressants can be used for anxiety disorders. In antidepressants, it can be SSRIs, selective serotonin reuptake inhibitors. In SSRIs, there can be escitalopram, sertraline, pyroxetine. Here, escitalopram is used for generalized anxiety disorder, obsessive compulsive disorder, which is off-label use. And another antidepressant SSRI is sertraline, used for panic disorder, social anxiety disorder. And another antidepressant is pyroxetine, used in obsessive compulsive disorder, panic disorder, social phobia and generalized anxiety disorder. Or it can be another antidepressant which can be serotonin, norepinephrine or noradrenaline reuptake inhibitors, for example venlafaxine and duloxetine. Venlafaxine is used in the treatment of generalized anxiety disorder, social anxiety and panic disorder, whereas duloxetine is used in the treatment of generalized anxiety disorder only. And older antidepressants, example tricyclic antidepressants and monoamine oxidase inhibitors are also effective, but a lower side effect profile favors the use of SSRIs. These agents have the additional advantage of reducing depression also, which is not uncommonly associated with anxiety. And let's see another class of drug used for the treatment of anxiety. It is benzodiazepines. And benzodiazepines are now mainly used for treating acute anxiety states, behavioral emergencies and during procedures such as endoscopy. They can be used as pre-medication before surgery, both medical and dental level, and under these circumstances their anxiolytic, sedative and amnesic properties may be beneficial. And now let's see the specific benzodiazepines. Chlordiazepoxide, used in pre-operative apprehension and anxiety, and the anxiety can be mild, moderate or severe, and the dose of chlordiazepoxide depends upon which type of anxiety is it. Is it mild, is it moderate or is it severe? And next benzodiazepine is clonazepam, used for the treatment of panic disorders, essential tremor, off-label and anxiety. Here we are talking only about anxiety disorders. So clonazepam and other drugs which we are talking here, they have other uses also, but here we are talking about only its use in anxiety. And another drug which can be useful is diazepam, used in the treatment of anxiety. And let's see another class of drug which is antiepileptics. Antiepileptics can also be used for treatment of some kind of anxiety disorders. Example, gabapentin is used for restless leg syndrome, which is off-label use. And tiagavin, sodium valproate, levetiracetam may be effective in treating generalized anxiety disorder. And another class of drug is 5-HT1A, or this is a serotonin receptor subtype, ST1A receptor agonist. The drug is buspirone, which is effective in treating generalized anxiety disorder. And another class of drug which is also used occasionally is antipsychotics. And some atypical antipsychotic agents such as olanzapine, risperidone, quetiapine, and ziprasidone may be effective in generalized anxiety disorder. And another class of drug used in anxiety disorder is beta-adrenoceptor antagonist. The most common example used is propranolol, which is used to treat panic disorder, which is off-label use, and it is also used to treat aggressive behavior, which is also off-label use. And these beta-adrenoceptor antagonists, they are not used to treat the anxiety itself, they are only used to treat the symptoms of anxiety. For example, tremor, shaking, or tachycardia, sweating. Such kind of symptoms can be treated or can be minimized with the help of beta-adrenoceptor antagonist. So this was all for the introduction of anti-anxiety drugs. If you have any problems, please comment below, and thank you for watching. See you in next video.